Dry socket. A dry socket is any socket or a hole in the jaw area where the tooth was removed. There is a severe pain due to the loss of the blood clot, thus exposing the bone to air, food and fluids along with an offensive odor. Dry socket is the most common complication of an extraction. This often occurs 2 or more days after an extraction and can last about 5 to 6 days. It is a very painful condition that can be easily treated. Prevention of dry socket. Women who use birth control pills or have their teeth removed in the first 22 days of the menstrual cycle are twice as likely to develop dry socket after an extraction. Schedule extractions during the last week of your menstrual cycle, days 23 through 28, when estrogen levels are low or inactive. Avoid drinking through a straw. Avoid smoking. It contaminates the extraction site. Avoid excessive mouth rinsing. It interferes with blood clotting. Chew on the other side of your mouth. And gently rinse your mouth with warm salt water. Treatment could include the following: medication applied to the site, clove oil technique, additional home care instructions. Continue these instructions for the next 3 to 4 days.